Hello, everyone. I'm Sheldon Barlett Rumor, and this is it. Welcome back to This Is It TV. I'm so excited for this conversation. I want to dive on in with my dear friend. I want for him to reintroduce himself, his first and last name, and all he's up to.
Sheldon, I'm Louis Bezich, men's health advocate, contributing writer to phillyvoice.com, and the author of Saving Men from Themselves,
Mm.
20 Proven Tactics with a New Approach to Healthy Living for Men Over 50.
Ah,
How are you?
I'm so good. I am so good. I'm always better when I talk to you. Always a clearer perspective on how to live a better lifestyle. What do we got going on today?
Well, we have success going on today, and the question is, what can we learn from that success?
Yeah,
So let me unpack it for you. So
sure.
the CDC recently issued a report that showed that the percentage of Americans that smoke cigarettes is at a historic low of 10%. Actually, it's 9.9% to be exact.
What?
And that compares to the historic high was way back in 1954 at about 45%. So that's a 75% decrease over those 70 plus years. So that's a
Wow.
great thing because we know, as we were just talking offline, that
Sure.
cigarette smoking was really embedded in our culture, in the
Sure.
arts, in
Sure.
everything that we did.
Yeah.
And now it's not. And
Yeah.
so, what can we learn? My question, and what I want to talk about today is what can we learn from
Yeah.
the smoking reduction, and
Sure.
how can that be applied to our current challenge with what you and I discuss all the time, which is lifestyle, what the
Yeah.
experts call lifestyle diseases like cancer and
Yeah.
type 2 diabetes and heart disease. And how can we make that work? And how can we promote healthy lifestyles using the learnings and the experience we have from smoking?
Interesting, interesting. And we were talking before we hit record about how it was in television and film and the fact that 40% of a population was doing or participating in any activity, needless to say, smoking. I can acknowledge, that in general people didn't know what they didn't know, right? It was a
Right,
social kind of space. It was based on entertainment. It was based on socialization. You went and took a smoke break, right? And multiple times a day, created
right,
connection, all of those things, I think we can recognize were true. But then the studies, which I know you're always backed by data, the studies
absolutely.
started coming out, right? People started to get sick, right? And all of the things started to happen. And so in that evaluation, in that look back, talk to me about the kinds of things that you're seeing based on the smoking, the decrease in smoking, based on what's going on now? Is it the consumption of, processed foods? Is it what can we equate or see as kind of a guiding light as we move forward to decrease as well to be able to get to better, healthier outcomes?
Sure. Well, here's what I think we can glean from the smoking example, the
Yeah.
cigarette example. Number one, that we've got to rely on support from beyond what an individual can do, right? This is a cultural phenomenon
Yeah.
that's going on now. And same with the unhealthy lifestyles that, I talk all the time about how we've got 70% of Americans are either obese or overweight,
Sure.
like 7% lead a healthy lifestyle. So how do we change that? Well, number one, look at in the cigarette smoking example, it was a combination of factors. It was a puzzle with various pieces. One
Yeah.
piece was education, taking that science that we had back in those days and disseminating it through the population to our children, to adults. To this day, the federal government still, spends our tax dollars, and I think wisely,
Right.
on smoking cessation commercials and things to
Yeah.
really socialize that message throughout society. Now, look, it's been 70 years of this, so it's finally breaking through, but
Right.
that's important because that begins to change values, right?
Mm,
Our values that say, "Ooh,
right.
is it good for me to smoke when I've got
Right.
children in the house?" It's the
Right.
whole notion of secondhand smoking. And what
Yes.
did those change in values do? As a public policy guy, I can tell you that turns into change in policy, right? You
Mm,
can't smoke anymore on
right.
airplanes, right?
Right.
Because now we're thinking about it's not just us, it's the people around us. You
Right.
can't smoke anymore in public places or in
Right.
restaurants, right? And
Right.
I would suggest to you that that wasn't kind of forced on, yeah,
Right.
it's laws and regulations, right? But
Sure.
it reflects our values that we were accepting of that. We didn't see we don't see today at least huge
Right.
protests and things like that against it. So that's the pattern. You want to educate, you want to inform, you want to have people understand the consequences of their unhealthy behavior, and then change that into tangible things that can really get us to those reductions like we see with smoking.
Agreed, agreed. And I think that there was, I mean, obviously there was financial support and resources put behind the language around secondhand smoke, right? That somebody had to sit around the table and coin it that, right? And then that
Yep.
information had to be disseminated consistently. And oh my goodness, I hope that getting healthy or changing lifestyles doesn't take another 70 years in order for us
Yes.
to
Yes.
achieve. But I do think that it has to be a concentrated effort and would love to hear your opinions about or an expansion of your opinion about the importance of that education, right? Because it can't just be, okay, we know what we know. We know we should be eating better. We know we should be working out. We know we shouldn't be eating, things that have all of this saturated fat or all of this extra sugar. We know that, but should we be participating in more educational programs? Should there be more educational programs? Should there be more specific campaigns with specific language? I'd love to get your opinion on that.
Well, the answer is all of the above,
Yeah,
right? There, again, it's a puzzle with
yeah,
multifaceted pieces to it. Number
yeah,
one is, yes, more campaigns, more information out there. But today now, it's not 1954. We have the internet, we have
yeah,
social media,
yeah,
and we have those folks that we call influencers, right? We've
yeah,
had we've
for
had
sure.
discussions about,
Yeah,
running clubs and
yeah,
how a number of rock stars and people
sure,
in the public realm have
sure.
sponsored these runs and things. So more of that kind of stuff where
Okay.
social influence, whether it be government sponsored PSA, public
I
service
love that.
announcements, whether it be the private sector, whether it be influencers, we've
Okay.
got that extra tool, which is so important to, what we call social cognition, right? The spread
Yeah.
of a new cultural change, right?
Oh,
And then
love that.
as individuals, we can create our own, what I like to call our lifestyle ecosystem, right?
Mm,
What does that mean? That means that whether it's our family, whether it's our community, whether it's our colleagues at work, you begin to work with those folks and find a gym buddy, like we've talked about before,
yeah,
or a spouse adopts a healthy lifestyle so that
sure.
both spouses can support each other, and even the children or intergenerational dynamics. That's all part of what I like to call your lifestyle ecosystem. You put that all together on a more personal basis.
Yeah,
Layer that that gets layered on top of this common, more community government
yeah.
influenced messaging out there and the transmission of the science.
I see that.
That's the pathway.
I see that. I see that clearly as for us in marketing, it's kind of a sales cycle, right? Of what that kind of
Yes.
looks like. And we create all of the different verticals, again, using all these marketing terms, but all these different verticals and where does it make sense? And really attacking it from all of these different components, ideally with everybody using the same language and on the same page, right? Just as committed as they were to reducing the amount of smoking that was happening socially. I think that for a number of these different, I guess, areas, us focusing on what is that language? Who are we educating? Are we doing it from the corporate sector, civically? Are we doing it, at home, part of that ecosystem, and making sure that everybody's moving in the right direction to live a healthier lifestyle? No, I love that.
Yeah.
I
No,
love
there's so
that.
much we can do. And you see it from a marketing standpoint. You see it in like life insurance
Yes,
commercials, right? You see it's that
100%.
they promote that end game, right?
Yeah,
That you need to think about things, the future,
sure,
right? Which
sure.
is what deters people to diet and exercise because they're not thinking about the future, they're just thinking about now. So
Yeah,
there are snippets out there. There are pieces, as I said, with influencers and other. I think we just need to pull it together and
yeah.
really have a concerted effort. And we won't have to take 70 years to get to the promised land.
Exactly. Exactly. It is a grassroots effort. I mean, my goodness, I would like to decrease the amount of time from 70 years to something significantly shorter, but knowing that it equally is not an overnight scenario, right? Like it's
Right.
equally something that we have to nurture. It's equally something that we have to commit to. It's equally something that we have to be consistent and remind people. Do you agree that, though we don't want it to be 70 years, give
Yeah.
ourselves some patience as it relates to kind of gearing this up?
Absolutely. Think about one of our other hot topics, longevity, right?
Yeah.
And think about the demo. We've got baby boomers, we've got Gen X,
Right.
Gen Z, all pushing for a longer, healthier life. Well,
Sure.
let's seize that moment. Let's
Yeah.
look at that as an opportunity to really convey this message in a big way.
Yeah.
Excuse me. And then, we've got the greater opportunity for success.
I love this. I absolutely love this. I think we as Americans should be commended that we went from 40% to
Yeah.
10%. I mean, there's few things to celebrate these days, but maybe this is one of them. I could at
Yep.
least take a round of applause for decreasing that amount, paying attention to
Mm.
all of those things in which we talked about, the information coming from the corporations that are helping us understand it better, coming from our civic groups and our municipalities that are sharing the information, and then obviously our social groups that are encouraging us to, listen, you're going to have to go outside with that if that's what you're going to do.
Yeah.
Therefore, we decrease it. It's too cold. All of the things that keep, you can't, you mentioned planes. I remember nightclubs and restaurants and the
Sure.
mall, right? There was
Yep.
ashtrays in the middle of the mall as people were
Exactly.
shopping and smoking at the same time. It was a
Yep.
different lifestyle altogether. And the shift was a full unit shift socially
Yes.
throughout the United States. And that takes a big effort from everyone involved.
This is as much of a social play as it is a medical play,
Yeah, for
for
sure.
sure. The
For
social will
sure.
drive the medical adherence, and that's what we need to take away from this
I love it.
cigarette.
I love it. This one was good. This one was really, really good. Eye-opening. Again, when we focus on something, real change can happen. So I love that you brought this to our attention and that we were talking about it this morning. If people want to get in touch with you, Lewis, if they want to follow, fan, and like you, get their hands on that new book, where do they find that information?
Social media, you can get me at Louis Bezich. And of course, my website is louisbezich.com, where you'll see everything that's going on in my world of healthy lifestyles.
I love it. It's that simple, my darling friends. Get
Mm.
in touch with my dear friend. I promise you, you will not be disappointed. From all of us here at This Is It TV, I'm Sheldon Barlett Rumor, and we will see you soon. Take care.